Good morning, this is Dr. Farah. I am a neurophysiotherapist. In this class, we will learn about the pediatric reflexes. What are the pediatric reflexes? How can we assess them? What is the onset and integration of the pediatric reflexes? And what are the different types of pediatric reflexes? So, before proceeding to the definition of the pediatric reflexes, firstly we should know about the reflex first. So, reflex is an action that is performed without a conscious thought as a response to a stimuli. Whereas pediatric reflexes refer to automatic responses that babies are born with, indicating the proper functioning of their nervous system. It means pediatric reflexes are there in the baby when the baby born. But it's not true in all the cases. Onset and the integration period of all the pediatric reflexes are different, but it indicates the proper functioning of their nervous system. So these reflexes typically disappear as the baby grows and their nervous system matures. It means some pediatric reflexes, when they are there in the baby, when the baby born, they are disappear as the baby grows, and it is a clear indication that the nervous system is functioning good. So the pediatric reflexes are the automatic responses triggered by the specific stimuli without the conscious thought. It means they are the automatic responses. They are triggered by the different stimuli. When we want to assess the pediatric reflexes, uh, different stimuli is used for the assessment of the pediatric reflexes. Reflexes are controlled by the nervous system, primarily the spinal cord and the brainstem. We can say that reflexes are the proof of communication between the motor system and the sensory system. If reflexes are appearing and disappearing at the exact time, it means motor system and the sensory system is communicating well. So there are different types of pediatric reflexes such as the primitive, tonic, midbrain and the cortical reaction. Primitive is also known as the spinal or the neonatal reflexes, whereas the tonic is also called as the brainstem reflexes. So firstly we will discuss about the primitive reflexes. So there are 9 primitive reflexes such as the flexor withdrawal thrust, extensor withdrawal thrust, cross extension, grasp. It can be palmar and the plantar, traction reflex, Moro reflex, starter reflex, sucking reflex and the rooting reflex. We will discuss each and every reflexes, how can we assess, what is the onset and the integration of the primitive reflexes in the next slide. Before proceeding to the assessment of the primitive reflexes, we should know about the onset and the integration of the primitive reflexes. Onset is the time when the primitive reflex appeared, and the integration is the time when they are disappeared. So the onset of the primitive reflexes are same, such as the 28 weeks of gestation when the baby is in womb or during the pregnancy. Integration period is different for all the primitive reflexes. So firstly we will discuss about the flexor withdrawal thrust and the extensor withdrawal thrust. In flexor withdrawal thrust, the baby should be in the spine position, lower limb should be in the extended position. Then the therapist should scratch ball of the foot. And then the response therapist will get the extension of the toes, dorsiflexion of the ankle, flexion of the knee and the hip joint. Then the second one is the extensive withdrawal thrust. In this also the baby should be in the spine position, lower limb should be in the flex position. Then the therapist should scratch ball of the foot. Then the response therapist will get the extension of the lower limb or the stimulating leg. Third one is the cross extension. In this also baby should be in the supine position. Therapist should scratch ball of the foot, and the response, it is different because the response therapist will get in the non-stimulating leg. Non-stimulating leg will show the extension. When we stimulate the leg should be in the flex position. Then the therapist should scratch ball of the foot, and the other leg, non-stimulating leg, should show the extension, hip, knee and the ankle. Integration period for flexor withdrawal thrust, extensor withdrawal thrust and cross extension is same, that is 1 to 2 months. Then next one is the grasp. It can be palmar or the plantar. For assessment of the palmar grasp, the therapist should put his fingers on the baby's hand. Then baby should try to hold the fingers. The integration period for the palmar grasp is 4 to 6 months, and for the plantar grasp is 9 months. For assessment of the plantar grasp, the therapist should put his fingers over the metatarsal and baby tries to hold the therapist's finger with the help of the toes. Next one, in the traction, the baby should be in the spine position. Therapist tries to pull the baby's hand and the baby tries to sit with the help of the therapist hand. And the integration period of the traction reflex is 2 to 5 months. Then next is the Moro reflex. For Moro reflex, stimulation should be the disturbance of the balance, or we can say the backward thrust. When we give the backward thrust to the baby should extend his upper extremities, abduct his upper extremities and extend. Then the baby cries, and the after response should be the adduction, flexion, and the baby crossed his upper extremity towards his chest. Then the integration period of the Moro reflex is 5 to 6 months. Next is the startle. For the startle reflex, the stimulation is a loud voice. It is somehow same as the Moro reflex, but when the baby listen the loud voice, the baby should abduct or the extend his upper extremities, but the crying and the after response is missing in the startle reflex. And the integration period is different for the startle because it persists throughout the life. Then next one is the sucking reflex. In the sucking reflex, the therapist should put his fingers on the baby's lips. Then baby tries to suck the therapist finger. The integration period of the sucking reflex is 4 months. And last one is a rooting reflex. Rooting reflex is same as the sucking reflex, but in this the therapist should put his finger or should scratch lateral side of the lips. Then baby tries to move towards the therapist finger and tries to suck the therapist finger. The integration period of the rooting reflex is also the same as the sucking reflex, that is 4 months. It is all about the assessment. How can we assess the primitive reflexes and what is the onset and the integration of the primitive reflex. Next one is the tonic or the brainstem reflexes, which also has some subtypes such as the ATNR, STNR, TLR, or the positive supporting reflexes. ATNR stands for the asymmetric tonic neck reflex, STNR stands for the symmetric tonic neck reflex, and the TLR stands for the tonic labyrinthine reflex. We will discuss each and every reflexes with the thorough assessment and the onset and the integration. So the onset for ATNR, TLR and the positive supporting is same such as the afterbirth, but the onset of the STNR is 4 to 6 months. First reflex is ATNR, stands for the asymmetric tonic neck reflex. In this, the stimulation is a neck rotation. If the therapist rotates the baby's neck towards right side, then the response will be the extension of the upper extremity of the right side and the extension of the lower extremity also. It means right sided upper extremity and lower extremity both is in the extended position, and the opposite side, that is the left side, upper extremity and the lower extremity is in the flex position. This reflex is also known as the bow and arrow reflex and the fencing reflex. Integration period of the ATNR is 4 to 6 months. Then the next reflex is STNR, that is symmetric tonic neck reflex. In this, the stimulation is a neck flexion and the rotation. When the therapist flexes the baby's neck, the upper extremity will be in the flex position after the neck flexion, and the lower extremity is in the extended position. Then next is the STNR extension. when the therapist extend the baby's neck, upper extremity is in the extended position and the lower extremity is also in the extended position after the neck extension. Integration period of the STNR is 8 to 12 months. Then next is the TLR, tonic labyrinthine reflex. For this reflex, the stimulation is the prone position and the supine position. When the therapist put the baby is in the supine position, the upper extremity and the lower extremity will be in the extended position after the supine position. Then the therapist, when put the baby in the prone position, the upper extremity and the lower extremity will be in the flex position after the prone position. Then the integration period of the TLR is 6 months. Next is the positive supporting. In this, baby should be in the vertical position, vertical suspension position, and the feet should press the mat. Then the baby tries to hold his weight and tries to walk. This is the response and the stimulation, and the integration period of the positive supporting is 6 months. This is all about the tonic reflexes, or we can also say the brainstem reflexes. Next pediatric reflexes is midbrain reflexes, which also has some subtypes such as a neck writing reflex, labyrinthine reflex, body on neck reflex, body on body reflex, and the optical writing reactions. First one is the neck writing reflex. Onset for neck writing is after birth and the integration is 6 months. In this, baby should be in the spine position. Then the therapist should rotate the head towards the one side. Then whole body rotate towards that side. This is the response. Then second one is the labyrinthine writing reflex. Onset of the labyrinthine writing reflex is 2 months and the integration is it remains throughout the life. In this, the baby we can assess this in the prone, supine, and the sideline position. In this, vision should be occluded. Then therapist should tilt the body laterally, and the response the therapist will get. Head seeks vertical position in the space laterally. Head seeks vertical position in the space laterally. Then the third one is the body on body reflex. Onset of this reflex is 6 months and the integration is 18 months. Therapist should rotate or move the pelvis one side, then the whole body, or then the shoulder and the trunk move towards that side. Next one is the body on neck reflex. Onset of this reflex is 6 months and the integration is 5 years. In this, therapist move the body towards one side and then head also moves that side. Then next one is the optical writing reactions. In this, child is in suspended position. Then therapist change the position of the head from side to side. Then eyes will move towards the side of the head. This is the response. Onset of this is 2 to 3 months and the integration is throughout the life. Last pediatric reflex is cortical reactions, which also has some subtypes or the positions such as the prone, supine, sitting, quadruped, kneeling, and the standing. Onset of these positions are different. It means when the baby is able to maintain his balance in these particular positions. So onset is different, but the integration is same. It remains throughout the life. So onset for the prone position is 5 months, for the spine position is 7 to 8 months, for the quadruped position or the sitting position is the 6 to 8 months, and for the quadruped is the 9 to 12 months, for the kneeling is the 15 months. It is same for the standing position also. This is all about the cortical reactions. So this is all about the pediatric reflexes. How can we assess the pediatric reflexes? What is the stimulation and what is the response we are getting? I hope you will like this video. Thank you so much.